A single-tooth dental implant, consider it as a replacement root. It's a hollow titanium screw that's inserted into the bone, and the bone fuses onto that implant and allows us to quite literally screw a replacement tooth in without having to do anything to the neighboring tooth or teeth. Implants are generally placed in a sterile environment, and sometimes they can be placed without displacing the gum. Other times, if we need direct access, we'll displace the gum so we can visualize the bone. A little channel is made and the implant is inserted. Sometimes the implants can be inserted when the tooth is removed. We call that immediate placement. But if there's a lot of infection, sometimes we need to wait 6 weeks or so before we can place the implant. Once the implant's placed, sometimes we can immediately load the implant, which means putting a tooth on it straight away. But sometimes we will cover the implant over and leave it for 3 to 6 months to fuse to the bone, more likely 3 months. And that's necessary if there's been a significant amount of grafting being done, or if there isn't a benefit in immediately loading the tooth. Single implants are a great solution to replacing teeth without having to do anything to the other teeth. It is generally considered the wisest now that if a tooth is savable, we would save the tooth. However, sometimes teeth can't be saved. They have been a long way down their restorative cycle. And rather than having to do anything to the adjacent teeth, a single tooth implant means that we can provide a missing tooth, a replacement for a missing tooth, without having to touch the other teeth. So we're not having to drill other teeth, which makes it a great solution to replace teeth without having to be more invasive of the other teeth. Implants have a great success rate, and done correctly, that can be anywhere from 95 to 98% plus. However, one must be aware that we're dealing with the human body and healing with the human body, and occasionally the bone doesn't fuse onto the implants. The other problem very occasionally with implants is that we know that one can get gum disease around implants. And so it's very crucial and important that ongoing maintenance is kept so that we can maintain the health of the implant. Other than that, the risks are very few. Occasionally, screws can fracture, but those risks are really very minimal.